everybody. Welcome back to my channel, Error 404, Mental Health Not Found, your one-stop shop for all things mental health. I am your beautiful host, Tim, and today I have what I think is going to be a really fun episode for you today. In fact, it's going to be a 2-episode arc, and we'll get into that in just a moment as to what that's going to be about. But before we do that, I do want to cover my bases here, cover my ass as it were. I am not a doctor. I am not a therapist. I am not a psychiatrist. I am in no way trying to diagnose you with anything. I cannot diagnose you with anything. I cannot medicate you for anything. This channel is for entertainment purposes and maybe some educational purposes. Everything that I talk about is either coming from my own personal experience, the experience of people I have spoken with and been able to confirm, or in cases like these next 2 episodes, things that I have done a lot of work in researching. So I am going to supply all of the links to my research in the show notes for each episode, so you can definitely take a look through those. And feel free to message me if you feel like there are corrections that need to be made with anything. I'm always happy to make those edits after the fact. So now that we have that out of the way, what are we going to be discussing? Well, we're not going to be talking about any one specific condition or anything like that today. We are going to be discussing some rare and very unique disorders. The reason this is a 2-episode arc, because I want to do one full episode that's going to be on rare and unique disorders. The other one is going to be on rare and unique, like, physical conditions. I have done a lot of work to figure some of these things out and get some proper details on it. So I'm really looking forward to sharing that information with you. But I do want to note that some of these things are going to seem kind of far out there. Some of them are going to even seem a little humorous, and it is very important that we keep in mind that the people who do suffer from these conditions and these disorders, they probably don't think this is funny. So we need to be doing this with a sense of respect for those that do suffer from these conditions, and understand that we have to treat them the same way we would want to be treated with our own mental health conditions. So please be respectful. I know some of this stuff is going to be a little far out, and it's okay to smile a little bit, but let's not poke fun. With that said, let's get into these fun little disorders. Let's talk about the first one. Our first disorder, we are going to be discussing exploding head syndrome. Did I do the graphic right? Is that on there right? Did my head explode? Anyways, I found this one to be really interesting in a way. Exploding head syndrome, or oftentimes referred to as EHS, is a sleep disorder. It's characterized by the perception of loud and oftentimes explosive noises when falling asleep or waking up. But despite its alarming name, the condition is not typically associated with any kind of physical harm or danger, so keep that in mind as well. The noise is typically described as a sudden loud bang, crash, or explosion, and it's perceived as originating from within the individual's head. Individuals with exploding head syndrome may experience anxiety or distress due to the fact that it's so startling. It's so weird to hear this out of the blue, and these auditory hallucinations that can sometimes come with it. However, the episodes are usually painless and not accompanied by any physical sensations. The phenomenon is considered to be kind of benign and generally harmless, and it's just a sleep-related parasomnia in the end. The exact cause of exploding head syndrome is not well understood, but it is thought to be related to disturbances in the transition between wakefulness and sleep. So whether you're going from awake to sleep or sleep to awake, it's kind of that in-between area. There are other factors such as stress, fatigue, and irregular sleep patterns that can contribute to these occurrences and these auditory sensations. While there is no specific treatment for exploding head syndrome, reassurance and education about the benign nature of its condition can sometimes be helpful for people. So just reinforcing that it is pretty dang benign. Also, improving sleep hygiene, managing stress, and maintaining a regular sleep schedule can also help reduce the frequency of these episodes. But as with any disorder, it is essential for individuals experiencing unusual sleep phenomenon, including EHS, to consult a healthcare professional, preferably in this case a sleep specialist, for a proper diagnosis and guidance on managing any associated sleep issues. That's exploding head syndrome. All right, so our next one goes by a couple of different names. Lately, it's been called Cotard delusion. It's also known as Cotard's syndrome, but I think the best name for it is currently the walking corpse syndrome. It's a rare and severe mental health disorder. It's characterized by an individual's belief that they're either dead, they do not exist at all, or have lost their internal organs. People with Cotard delusion may express a range of beliefs related to their own death and non-existence, such as feeling like a walking corpse, or having no soul, or being devoid of any life entirely. The condition can lead to a profound disconnect from reality, and individuals with Cotard delusion may exhibit symptoms that come like extreme apathy, complete negation of bodily functions, and a sense of disembodiment. In some cases, they may even reject the need for food and or hygiene, as they already perceive themselves as lifeless. As with a lot of these disorders and conditions, I'm going to be saying this a lot, so buckle your seatbelt for that. But the exact cause of Cotard delusion is not well understood. You're going to hear that a lot. But it's often associated with underlying psychiatric disorders and neurological conditions and brain injuries. Some cases have even been linked to depression, bipolar disorder, and schizophrenia, or even organic brain disorders. So things that, problems with the brain that occurred naturally. Treatment for Cotard delusion typically involves a combination of psychotherapy and medication. Antipsychotic medications may be prescribed to address any underlying psychiatric symptoms, and therapies such as cognitive behavioral therapy or CBT, may help an individual challenge and reframe their own delusional beliefs. Cotard delusion is a complex and challenging condition, and individuals affected by it often require very specialized psychiatric care. It's crucial for those experiencing symptoms of Cotard delusion to seek professional help for an accurate diagnosis and for appropriate treatment. Cotard delusion is named after Jules Cotard. He was a French neurologist who first described the condition in the late 19th century. Jules Cotard presented a case series of patients with what he called negation delirium or negation syndrome in a series of lectures in the 1880s. The condition was initially referred to as Cotard's syndrome in honor of the physician who brought attention to it, but over time the term has evolved and the disorder is now commonly known as Cotard delusion. Cotard's original observations included individuals who denied the existence of certain body parts. They oftentimes claimed to be immortal or believed that they were entirely dead. The syndrome was later expanded to include a broader range of delusions involving death and non-existence. While Jules Cotard was instrumental in identifying and describing this condition, our understanding of Cotard delusion has developed further through subsequent clinical trials and observations, case studies, and a lot of research. Today, Cotard delusion is recognized as a rare and severe mental health disorder that is often associated with underlying psychiatric and neurological conditions. Walking corpse syndrome. Kind of creepy. So this next one is another one that I found to be very, very interesting. It's a little more common than some of the other ones that I'm going to be discussing on this episode. But it was really interesting. There's even a book series, it's a detective book series, where the lead character suffers from this due to a brain injury he suffered. So what is it? It's synesthesia. And I'm gonna keep butchering the name on it, but it's synesthesia. Synesthesia is a perpetual perceptual phenomenon, and it's in which one of the sensory or cognitive pathways leads to involuntary experiences in another. Simpler way of putting it would be individuals with synesthesia may perceive like a blending or overlap of their senses, causing them to experience sensations that aren't typical for most people. For example, a person with synesthesia might see colors when they hear music. They associate specific tastes with certain words or perceive numbers as having like a distinct personality. There are many different forms of synesthesia, and the combination of senses involved can vary wildly from one individual to another. But some of the most common types of synesthesia, and I'm going to butcher some of these names, so please bear with me. Graph-me color synesthesia. This is probably the most common form where letters and numbers are associated with specific colors. There's sound color synesthesia, where sounds such as music or voices trigger a perception of colors. There's number form synesthesia, where numbers evoke a kind of a spatial layout or a mental map for individuals. You may have seen something like that in TV shows and movies where they're, going through a complex mathematic equation in their head and they see it in front of them and everything's moving around. That's a form of synesthesia. There's spatial sequencing synesthesia. The concept of time, like days of the week or months, is often associated with a specific spatial arrangement. This one gets me. Lexical gustatory synesthesia, where words or sounds evoke specific taste for an individual. And again, the exact cause of synesthesia is not fully understood, but it is believed to involve a combination of genetic and neurological factors. Research does suggest that there may be differences in the connectivity of the brain in individuals that have synesthesia, so that's kind of interesting, in my opinion. It is important to note that synesthesia is not considered an actual disorder or pathology. The reason being is because it's actually considered a variation in perception that just some people experience. Many individuals with synesthesia find their unique sensory experiences to be consistent over time, and they don't really change. And in some cases, they even find them enjoyable. Synesthesia can vary in intensity and impact from person to person. I thought that one was really interesting. Synesthesia. Colors. All right, so this next one, I know I said we shouldn't giggle, and that's a little difficult to do on this one. This next one is called Stendhal syndrome. Don't be surprised if you've never heard of it, but Stendhal syndrome is also known as hyperculturemia, and it's a psychosomatic disorder that causes a range of physical and psychological symptoms in response to the exposure to art, especially when a person perceives the art as particularly beautiful and emotionally overwhelming. It's named after a 19th century French writer, Stendhal, and it's described as feeling dizzy and disoriented while he was viewing art in Florence, Italy. There's a number of symptoms that can come along with this syndrome. Some of them include things like a rapid heartbeat, dizziness, lightheadedness, fainting or near fainting, confusion, disorientation, trembling, shivering, nausea, vomiting, or even feelings of unreality or detachment from your surroundings. These symptoms are typically triggered by exposure to art, architecture, or other cultural experiences that are perceived as overwhelmingly beautiful and or awe-inspiring. While Stendhal syndrome is not officially recognized as distinct medical disorder in the diagnostics manual, like the DSM-5, some psychiatrists and psychologists acknowledge it as a real and valid psychosomatic response. The exact cause of Stendhal syndrome is, you guessed it, not well understood, but it's thought to be related to the emotional and physiological impact of intense aesthetic experiences in people who are highly sensitive and or have a predisposition to anxiety and or panic attacks. Management of Stendhal syndrome usually involves, removing the individual from the triggering environment, providing a quiet and calm space, and reassurance. In severe cases, medical attention can be necessary, but the symptoms typically subside once the person is removed from the stimulus. Stendhal syndrome is a unique and relatively rare phenomenon, and not everyone who appreciates art experiences such extreme reactions, but it does serve as a fascinating intersection between psychology, art, and an individual's emotional response to cultural stimuli. So that I did find that portion really interesting, how those things can intersect, psychology along with art, because art is supposed to be about emotion. And if it's triggering that kind of response in somebody, the artist did something right. All right, so this next one is actually referred to as a disease, although the jury is kind of still out on that. We are going to be talking about Morgellons disease. Morgellons disease is a controversial and very, very poorly understood condition. It's characterized by individuals reporting a range of very unusual symptoms, including things like a crawling sensation on or under their skin, the presence of fibers or threads emerging from their skin lesions that may or may not be there, and a feeling of being overall infested, with insects. The term Morgellons itself is not widely accepted within the medical community. The condition is not officially recognized as a distinct disease by major medical organizations. The symptoms reported by individuals with Morgellons disease often lead to significant distress, but there is a lack of scientific evidence to support the existence of a unique infectious or parasitic cause. Research on Morgellons is limited, and its etiology remains very, very unclear. Treatment for Morgellons disease is challenging due to that lack of consensus in its underlying cause. However, individuals who experience these symptoms are encouraged to seek medical help, as they should, and the approach to treatment often involves addressing associated conditions and or symptoms. Some of the components of the management may include things like a psychiatric evaluation. Since the symptoms of Morgellons are often associated with psychological distress, a psychiatric evaluation may be recommended to assess and address any underlying mental health conditions. Counseling, therapy, psychological support such as counseling or therapy may help individuals cope with the distress that is caused by the symptoms. Sometimes they'll give out topical treatments, like a dermatological treatment may be prescribed to address any skin-related symptoms such as itching or lesions. Antibiotics or antiparasitic medication. In some cases, healthcare providers may prescribe these medications to address the secondary infections or symptoms, even though there is no evidence supporting a specific infectious cause. It's very, very, very important to approach individuals experiencing symptoms attributed to Morgellons disease with empathy and sensitivity, because healthcare providers may need to adopt a multidisciplinary approach involving like dermatologists, psychiatrists, and other specialists in order to address the various aspects of this condition. Because Morgellons is a complex and poorly understood phenomenon, patients and healthcare providers should work collaboratively. They need to work together to manage symptoms and improve overall well-being. Seeking care from a healthcare professional experienced in dealing with unusual and challenging cases can be beneficial for those experiencing symptoms associated with Morgellons disease. Ooh, I'm itchy. So this next one I also found to be very interesting in my opinion. In fact, I kind of want to do a deeper dive into this at some point, maybe even do a short episode just on this one. We're going to talk about Fragoli delusion. Fragoli delusion is a rare psychiatric disorder. It's characterized by a delusional belief that different people are actually the same person in disguise. Individuals with Fragoli delusion are convinced that strangers, acquaintances, or even family members are one single person who is purposely changing their appearance just to deceive them for one reason or another. The name Fragoli actually comes from a Italian actor, Leopold Fragoli, and he was actually known for his ability to make quick changes during appearances on stage. He has a very interesting bio too, if you have a moment to look him up. But yeah, he was known for those quick changes. Treatment for Fragoli delusion typically involves a combination of medication and psychotherapy, but it's important to note that treating delusional disorders can be challenging, and outcomes may vary from person to person. But some of the most common approaches to treating Fragoli delusion are things like antipsychotic medications. These medications are often prescribed in an effort to kind of manage the psychotic symptoms, including delusions, and they work by affecting the neurotransmitters in your brain. It's crucial to find the right medication and dosage for an individual, and they may need regular monitoring in order to keep a lookout for side effects. There's also cognitive behavioral therapy, which you'll find in a lot of these different conditions. Cognitive behavioral therapy can be beneficial in helping individuals by challenging and re-evaluating their delusional beliefs. So therapists work with the patients to help identify and then modify their irrational thought patterns. There's also supportive therapy, and this one's important as well, if not more important. Providing a supportive and empathetic therapeutic environment is important for individuals with Fragoli delusion. This can help them feel understood and supported in managing their symptoms. And in rare cases, in severe cases, hospitalization may be necessary when there's a risk to the individual or the individuals that they perceive are deceiving them. If there is a risk to their safety, it may be necessary to hospitalize them to stabilize their condition. It's important to involve mental health professionals such as psychiatrists or psychologists in treatment plans. A comprehensive approach that addresses both the cognitive and emotional aspect of the disorder is typically very, very, very recommended. It's also important that family and social acquaintances show support. They also play a crucial role in the management of Fragoli delusion. Education and open communication can help family members understand the condition and provide the necessary support for the individual's well-being. As with many psychiatric disorders, early intervention and a collaborative, individualized treatment plan can contribute to better outcomes. So find it early and seek that help. Seeking help from mental health professionals is key for those experiencing Fragoli delusion to receive an accurate diagnosis as well as an appropriate treatment plan. Am I a second person? So this next one, I also found equally interesting. I mean, I wouldn't be on my list if I didn't find it interesting, so I actually find all of these to be rather interesting. This one involves a lot of long words, so bear with me on those because my ADHD and doesn't always let me pronounce things correctly. But we are going to discuss reduplicative paramnesia. That's right, you heard it here first, folks. Reduplicative paramnesia is a rare psychiatric disorder, and it's oftentimes associated with the delusional belief that a familiar place or location has been duplicated, existing simultaneously in two or even more locations. Individuals with this disorder may insist that a specific location, such as their home or a workplace, exists in multiple identical copies. It's often considered a subtype of delusional misidentification syndromes. Treatment for reduplicative paramnesia involves a combination of pharmacotherapy and psychotherapy. However, treating, as with any of these, treating delusional disorders can be very, very complex. Outcomes can vary depending on a individual and how far along they are. Some of the more common approaches are antipsychotic medications. Like we discussed earlier, these medications are frequently used to manage psychotic symptoms, including delusions. Antipsychotics, again, work by affecting the neurotransmitters in the brain, and they can help reduce the severity of these delusional beliefs. And with any medication, finding the right dosage is essential, and you do want to make sure that you are closely monitoring for side effects in case that comes up. And then we kind of go back to the cognitive behavioral therapy, or CBT, as we discuss in a lot of these, and it can be beneficial because it does help individuals challenge and reevaluate their delusional beliefs. Therapists work with patients to identify and modify irrational thought patterns associated with these delusions. They also do something called reality testing. I had not heard of this before. Reality testing with therapists may engage in this reality testing exercises to help individuals question and learn to critically evaluate their delusional beliefs. This involves exploring evidence and encouraging a more objective perspective to things. And then there's the supportive therapy. Providing emotional support and a therapeutic environment is really crucial for an individual with the duplicative paramnesia. Supportive therapy can help them cope with the distress that is caused by these delusional beliefs. And with any of these, as in with severe cases or when there is a risk to an individual or others, hospitalization might be necessary to ensure their safety, other safety, and provide a controlled environment to stabilize the person's condition. As with many psychiatric conditions involving that mental health professional, like a psychologist or a psychiatrist, is crucial. It's important in developing and implementing a comprehensive treatment plan. And then again, with a lot of these, family and social support are invaluable. They are huge components in the overall management of reduplicative paramnesia, making sure that they are feeling seen and understood. Because it really is essential to tailor the treatment approach to an individual's specific needs for their symptoms. And with this one, again, early intervention and ongoing collaboration between the individual, healthcare providers, and their support networks will contribute to better outcomes. So find it early, talk to somebody, be supportive. It's very, very important. I've seen this workspace somewhere else. This next one was also a little bit hard not to giggle at, but it is a recognized disorder, so I am going to refrain out of respect for the individuals that are experiencing this. We're going to talk about boanthropy. And if you've never heard of it, neither had I until I started researching some of these. Boanthropy is a rare psychological disorder where an individual believes that they have transformed, like physically transformed, into a cow or an ox. It's often accompanied by corresponding behaviors. So they're like mimicking the movements of a cow or an ox, and they're also mimicking their vocalizations. They may go around mooing. They may charge at people. It's not always limited to a cow or an ox, but those are the most common ones by far. And then the treatment plan for this involved that same combination of psychiatric interventions, including medications and psychotherapy. So again, we're talking antipsychotic medications, we're talking cognitive behavioral therapies. We're going to go back to that reality testing. They need to be challenged on the fact that they are not actually a cow or an ox, but a person. Supportive therapy from both the healthcare providers as well as their family and friends. And if it is severe, that hospitalization until they can stabilize the person's condition and work out a treatment plan. So if you think you're a cow and an ox, by all means, please stop what you're doing and go talk to a mental health professional. Moo. I'm sorry. I'm so sorry. I'm so sorry. All right, I got one more for you here, and this one is the closest one to me being able to say I've experienced some form of this, not to the extent that I'm going to describe, but you know, there was definitely some of these symptoms from when I went. We are going to talk about Paris syndrome. Paris syndrome is a transient psychological disorder, and it primarily affects individuals who are visiting Paris, France, hence the name Paris syndrome, and it's characterized by symptoms such as anxiety, delusions, and hallucinations triggered by the discrepancy between the idealized image of Paris and the reality experienced by that individual. That was me. Both my husband and I experienced that a little bit, but we were able to twist it a little into our favor, because when we got to Paris, it wasn't what we expected. It is not that, well, I shouldn't say it's not that idealized, romanticized version, because a lot of Paris actually is. Paris is stunning and gorgeous and beautiful from the waist up is the best way I can describe it. But it's a city like any other city. There's going to be grime, there's going to be grit, there's going to be graffiti. You just don't see that in TV shows. You don't see that in the movies. And you think of this old, beautiful, expanding city that is stunning and gorgeous, and it is, but it's still a city. And there's still going to be that grit and that grime, but we were able to look at things like the graffiti and learn that graffiti is part of the city. That's why they don't get rid of it. They believe that that is art, and so many artists come from or lived in Paris. They don't want to get rid of art, even if it's just something somebody scribbled on the side of a building or a door or something. So it can be a little more hardcore and less romantic in some areas of Paris, but I would still 110% recommend that you visit for sure. But listen to the rest of this first. So some of the key features of Paris syndrome include delusions of grandeur. So individuals may arrive in Paris with a overly romanticized and idealized expectations. And when that reality falls short of these expectations, they may experience a sense of disappointment, leading to symptoms like anxiety and delusions. Hallucinations. Some individuals experience these hallucinations or dissociative symptoms where the surroundings seem either unreal or surreal. Culture shock. That's a good way to express it as well. Culture shock of encountering a different culture and lifestyle, especially for individuals with that idealized view of Paris, and that can contribute to the development of this syndrome. It's very important to note that with Paris syndrome, it is not officially recognized as a psychiatric diagnosis, and it is not included in the standard diagnostic manuals like that DSM-5. The term is used more informally to describe the cluster of symptoms experienced by a small number of individuals who are visiting Paris, France. So what can you do about Paris syndrome? Well, counseling and support for individuals to help kind of talk to them about their culture shock and unmet expectations. That can be very beneficial. It may involve helping individuals adjust those expectations to cope with the reality of their experiences. Raising awareness about cultural differences and providing education to tourists about the realities of travel can also help manage expectations and reduce the likelihood of developing severe psychological distress when you're traveling. Offering support services for travelers specifically, such as cultural orientation programs, helplines, or even information centers can assist individuals in navigating unfamiliar environments and mitigating potential stressors. And in severe cases, individuals experiencing significant psychological distress should seek professional assistance from mental health professionals. Psychotherapy and, if necessary, even psychotropic medications might be considered. It's important for individuals planning to travel, to be aware of the potential challenges associated with any kind of culture shock, and to approach new experiences with an open mind. And while Paris syndrome is relatively rare, understanding the realities of travel and having realistic expectations can contribute to a much more positive and fulfilling experience when you do travel. But again, go to Paris. Oh my God, I loved it so much. Oui, oui. Alright, so those are some of the very rare and unique disorders that a very small percentage of people have experienced in their time, but that I found to be very, very interesting. The follow-up video for this, the next episode, is going to be more about very rare conditions that might affect somebody physically, whether it is a disease, a skin condition, or the like. So stay tuned for that one to pop up soon as well. That will be part 2 of this series. So I've done a lot of research into that one as well. In the meantime, I hope you all have a wonderful mental health week, and don't forget, life is just a movie, and our brains, well, they're the twists we never saw coming.